Now, because this is intimate and it's just us here, by all means, if at some point I say something that you want to, that you have a question about, please do. Okay. And I will tell you all that this discussion, this talk that I'm gonna share with you, it is based on something that I had just been thinking about a lot. As you all know, or may not know, I am a storyteller, and I actually have found that stories have been some of the most meaningful ways to teach, some of the most meaningful ways to connect with people, to make a point, to make something stick, even to give feedback to someone. It's everybody has a story, and if you think about the power of storytelling, you can take that and wield it in a really mighty way. So, I began thinking about how stories can really be revolutionary. Like, if you want to change something, if you want to make a difference somewhere, you can strategically and intentionally use stories to make a difference. And that's really what I'll be talking to you about. Let's see my advances. Okay. I don't have any financial disclosures. I don't have any off-label drugs to mention. I'm not that big a deal. I do hope to be a big deal like that one day, but that has not yet happened. I do make sure people always know that every single day, 365 days per year, I cry at least once. Sometimes I cry in lectures. Sometimes I cry on rounds. I just cry. And I just think I give that though, because sometimes people aren't used to seeing that. And I think we just need to normalize responses other than sarcasm, dark humor, um, or silence. Sometimes people cry. So that's my only thing that I have to tell you in advance. I start everything I do with gratitude. I'm really grateful for pivot points and pivot people. This gentleman, he's actually a critical care doctor. His name is Sanjay Desai. Sanjay was following me on Twitter and saw something that I was posting about this conference that we had called Beast Mode for bite-sized teaching, and reached out to me, cold call, and said he wanted to just hear more about it and talk to me about it. I tried to get it published a couple of times. It had been rejected. So it was kind of like just in the limbo space of me thinking it was cool and posting the flyers on Twitter. So after talking to him, he was like, "Wow, this is so cool," that he invited me to Hopkins to do a visiting professorship and do the beast mode and coach people on beast mode lectures. One of the people that I coached in that session was somebody you all know, Dan Ambender. And Dan was giving, I sat in a room for a full day and gave 30-minute coaching sessions on these 8-minute talks. And Dan was like my fourth person. He gave a talk on aortic stenosis. I still remember. And that was the day I met him. And at the end of the meeting, he just kind of said, yeah, he had a lot of ideas for things he wanted to do with teaching. And that fleeting meeting, I was lucky enough to be able to come back 4 weeks later to watch them give the talks. And again, like teaching, how we have spaced learning. I think it was like spaced connection, right? So that ended up allowing me to draw closer to him. And it was there also that I met Reza Manesh of the Clinical Problem Solvers, who didn't have the podcast yet or anything. He was just a junior faculty member, fresh out of residency at UCSF. And we became friends too. And those connections ended up going a long way. I'm a graduate of Tuskegee University. I always like to mention that to people because a lot of times doctors, their idea of Tuskegee is connected to the untreated syphilis study that happened in Macon County, Alabama. I have a son at Tuskegee right now. He's a fifth generation college student at Tuskegee, which is where I went to school, where my parents met, my grandparents met, and my great grandmother went. So I do hope that me talking to you will completely change what you think whenever you hear the word Tuskegee. I love this beautiful statue that was at Hopkins when I visited that during that time. If you've ever visited there, you've probably seen it, but not so much about religion or anything as much as there's just a historic component that if you ever read the story of Henrietta Lacks, she speaks of coming in and describing that statue. And I just love the connection of history, legacy, and triumph that so many people have. And stories help us do that. I mean, images, you can look at an image. I've already told you a story, right? I told you the story of how I even came to be connected to the CardioNerds. It was really just by a chance meeting and staying connected, and someone asking to talk to me, and me saying, "Sure, I'll listen to your pilot episode. Sure, I'll tell you what I think." So a little can go really a long way and can be the thing that helps us to survive. So with that, I would also just like to share gratitude for my dad, he passed away in June of 2022. He was a very proud Tuskegee alum, but also an amazing storyteller. And as we're on the eve of Juneteenth, I think it's important just for me to introduce you to him, because one of the historical things that Black American people have done throughout the years, long before Juneteenth was a federal holiday, was that the elders would tell stories. They would tell stories of survival, tell stories of triumph. And part of it was listening. It was all stories. And so if you're wondering how you can be supportive to someone during Juneteenth, ask them what they're doing, or what are you doing tomorrow? Or are you doing anything special? Or just say the word Juneteenth. For some people, just the very acknowledgement of the word alone is plenty. So that in itself is a really important thing. So every time any of us teach, we should actually teach based upon something that we hunger to learn ourselves. This is Toni Morrison, probably one of the most renowned storytellers ever. She was a Nobel laureate for her stories. And this late author, her first book she published at the age of 39, The Bluest Eye. And she said when she wrote that book, it was the book I wanted to read. That's why she wrote the book. Couldn't find it. She couldn't find it. And I've learned as a teacher that it's important for me to teach things in a way that I haven't seen it yet. Teach things that I want to learn myself. So I think you should teach the things you wish to learn and give the lectures you hunger to hear. Start the conversations that you wish somebody would begin, and tell the stories that you feel need to be told. You know, when Dan and Ahmed started the CardioNerds, they were teaching the things they wanted to learn. They wanted to do something a little bit different. They wanted to see something done in a way that they hadn't seen it done. And my hope is that all of you will begin to think that way as well. So my objectives here are that we'll just recognize the importance of narrative medicine as a way to build empathy and lead to action. You may not think that for you as a future cardiologist or a current cardiologist or a current resident that this matters, but it does a lot, because what we do as doctors is we're advocates. We're advocates every single day for our patients. And again, stories can really help us move things forward. Also to show you the connection between narratives and advocacy, and apply lessons from patient stories to policies, to research questions, and to our behaviors. So my origin story and the origin story of my family begins in Alabama. If you look at this map here, Tuskegee, as I already told you, is of significance to my family. I am a descendant of human beings who were enslaved in the United States. The vast majority were enslaved in Alabama. And Birmingham is sort of where we hail from. And like many people of my parents' age, after they finished college, they left the Deep South and followed what many know of as the Great Migration out of the Southern United States. And my family chose to go to California. So I grew up in California. I am a Southern California girl who grew up with grits on the table because my family is from the South. And that's not that unusual. In fact, most people my age that you meet from California, they're not, they're the first ones to grow up there. Their families are all from the South. So this is me as a kindergartner, but still, you know, my origin story still begins there. I would then go reverse the Great Migration back and go to Tuskegee. This is me in my dorm room. You could tell how long ago it was because y'all look at that picture of Prince with that big afro. Yeah, so that is me in my dorm back in the day, living my best life. And then I would go from there to Meharry Medical College in Nashville, Tennessee, and then started my residency in Cleveland, Ohio, in MedPeds, whoop whoop MedPeds, um, at Metro Health Medical Center some years later, and ultimately find myself in Atlanta, Georgia, at Emory University, where I've built my career since 2001. But you know, this background piece about me, all those things are in me. And regardless of the fact that I walk through the halls of Emory, every single one of us carries with us a story that sort of shapes the things that we feel urgency about, shapes even some of the things that we might be willing to go the extra mile for patients about. And for me, a lot of that is sort of rooted in these identities. And I think it's important for me to share this with you, because as I share some of these stories, it'll make a lot more sense to see, like, well, why were you on the hind legs about this issue or that issue, right? Um, so COVID in particular, as all of us know, disproportionately impacted certain communities, primarily those that were historically excluded, those for minoritized individuals, really had a rough time during the time of COVID. We also saw the intersection of another pandemic, which was the pandemic of anti-Black racism in 2020, which made all of this even harder. And in the middle of all of this, I was still, a mom, trying to figure out how to learn about this new disease that nobody had heard of, trying to make sense of things happening in the world, and then having kids at home who are asking me all of these questions. And then we get a vaccine, and we're trying to figure out how to get this vaccine to more people. And what we were reading on every day and hearing on the news was that, oh, I think somebody needs to mute before you start cussing, wherever you are. um, but it became really, really challenging for us during that time, especially as people refer to individuals as hesitant and using all these words. And I just found myself thinking of how can I do something more rather than, wagging a finger and telling people what they should do or what they shouldn't do, or how could they do this? What could be a way that I could, help people understand what they needed to do, or try to change the direction things were going without being preachy. So that's sort of where I was in the time of COVID. And what happens when you get ready to try to do something or change something, all of your identities start to come together. And I began to feel as though, particularly as a leader, that there was something more that I needed to do during that time. So I'm a professor. I'm supposedly a DEI leader. I had been a visiting professor at some places. I'm a mentor, a medical educator. How do what do these identities mean, along with the identities I told you in my story, to help me move something ahead? And I know I'm a storyteller, and I began thinking, like, well, I'm inside of my house, I can't go anywhere. What can I do? And I began asking myself, how could I, from my computer or my phone, figure out a way to do something meaningful in a time where I was feeling moral distress and a sense of urgency. And it's not always going to be something like this. Sometimes just the sense of urgency you could feel is just, why can't my patients get the medication that they need? Like, why? Why can't they get this? Why is it so hard for somebody to get insulin? Things like that. So sometimes you will feel very, very small, even though a list of things and titles make you seem big, and there may be something more you can do. I drew a lot of inspiration from this woman. Not sure if you know who this is, but this woman, her name was Mamie Till. Mamie Till was the mother of a teenager named Emmett Till. He was her only son. They lived in Chicago. They had followed the Great Migration out of Mississippi and gone up to Chicago, where she was raising her son as a single parent. And he begged and pleaded to go spend the summer with cousins down in Mississippi. And while in Mississippi, as the story goes, he was accused of speaking or whistling or saying something to a white woman in a store, and they came and pulled him from his grandfather's home, and he was lynched. So his body was so amorphous that they wanted to have a closed casket, and his mother, she made the decision to let the world see. That was her quote. She said, "Let the world see. Let the world see what happened to my son." And honestly, the death of Emmett Till was a turning point in the civil rights movement. It was probably far more meaningful than Ms. Rosa Parks refusing to get off the bus, because that was when the papers all published what her son looked like, and her letting the world see. This is before social media or anything. Truly, truly made a difference. And she was courageous. You know, she told her story. She went different places. She spoke out. It took a lot of courage, but many say that she is really one of the true mothers of the civil rights movement. Her bravery, her willingness to tell that story and let the world see, it really changed everything. And so some say 100 days after Till's murder, Rosa Parks refused to give up her seat to a white passenger on a Montgomery City bus and was arrested for violating Alabama's bus segregation law. 100 days before that was when Emmett Till passed away. So what does it mean to be a revolutionary? For something to be revolutionary, it's involving or causing a complete or a dramatic change. And so to quote the good John Lennon, you say you want a revolution. Well, you know, we all want to change the world. And I am hoping that you'll see that a story, just a simple story that lets the world see, can sometimes do more and as much as the paper that's a randomized controlled trial, to move people to do something different than what they would have done before. What is advocacy? Advocacy is public support for an idea, a plan, or a way of doing something. And again, coupled with revolutionary, it's involving or causing a complete or dramatic change. So oftentimes what we're trying to do as advocates, sometimes it's just in a room with our patients, but sometimes it's in the form of you writing a paper or writing a grant and trying to move the needle or something, asking a question. But oftentimes to get there, it requires for you to do something big, for you to change people's mind, for you to even tell a story in your grant application to get someone to understand the importance of what you're talking about. And narrative is really a spoken or written account of connected event. So far, what we've been doing so far is really narrative, right? That's what I've been doing with you to date. And every time I think of Mamie Till and I feel like afraid to do something, I think about how courageous this woman was, and what a tremendous difference she made. She didn't really even get very famous for it, you know. But any who study the civil rights movement know that her very simple quote of "Let the world see" really was a pivot point for the world. This is a woman, her name is Rita Sharon. When you talk about narrative medicine, you can't talk about narrative without talking about Rita Sharon. She's probably sort of the person who coined the term, and she does she has a master's in narrative medicine offered at Columbia. Those who are in the New York area probably have heard of her some, but she has written lots about narrative and says that the effective practice of medicine requires narrative competence. That is the ability to acknowledge, absorb, interpret, and act on the stories and plights of others. From hearing all of your introduction, that's what you're all doing every day. So you say you want a revolution. Well, you know, we all want to change the world. So how do we change the world? We change the world through our mission. And the key with your stories is to how do you determine what your mission is, become mission driven, and then use those stories to become a shapeshifter. For me, my mission involves underserved communities, dismantling stereotypes, access to care, health equity, building trust, medical education, psychological safety, inclusion, mentorship, fighting racism, humanism, diversity. And you have what your mission is too. And I firmly firmly implore all of you to think about what is your mission, because that helps you know what to say yes to, what to say no to, and what you wish to do next. So my mission has pretty much landed me at Grady Hospital. I came to Atlanta to come to Grady. I wanted to come to Grady Hospital, and then when I applied to jobs out of residency, I was like, well, I know I want to take care of people who have really low resources. I knew the lowest resources were in the Southern United States. And then I said, I want to go somewhere where I can teach medical students and residents. And I want to go somewhere that have professional sports teams, but that's separate from my advocacy desire. But the most important question you can ask when you're trying to figure out what your mission is this one. What breaks your heart? If you want to do something with zeal and not get tired of it as an advocate, ask yourself that question. What breaks your heart? And a lot of the things that break my heart were happening in and around the Southern United States and in a safety net hospital. And so I knew that I would find myself somewhere like Grady, which was a great fit. And what our stories can do is let the world see, and not just see what's bad that's happening. You can let the world see what is good. Like I recognize that in the time of COVID, a lot of my patients, they had very, very strong opinions about things, but the world had this idea of them as just hesitant. And I said, well, what if I painted a picture of individual people in a way that helped people change the way that they thought about how we see things? And so I began to think about, well, okay, this is my mission, and let me think about what I want to do. Okay, I care about inclusion, health disparities, building trust, mentorship. So how can I use a story to help move the needle forward in this area? So for inclusion, maybe what that could mean is I want to reframe the way we honor historical contributions. That is, I want to tell stories that get you to, instead of thinking only of Rosa Parks or only thinking of the untreated syphilis study when you hear the word Tuskegee, I want to tell a story in a way that changes the way you honor a historical contribution, right? Health disparities. I want to make it clear the impact of structural racism. It's not just that people haven't pulled themselves up hard enough by the bootstraps, right? I want to show you what that looks like. And sometimes me arguing it, with you with Twitter thumbs is not the way to do it. Maybe I can show you better than I can tell you, and a story can do that. What about building trust? Maybe I can tell a story that helps people to change the way they're thinking about how trustworthy they are. Maybe people don't trust you because you have not been trustworthy, and maybe I can tell a story that helps to underscore that. And for mentorship, what if I can tell stories that inspire radical mentorship? Tell you a story of something that was just so outlandishly out the box that you then realize that, hey, maybe there is something more that I can do, right? And so I will tell you a few stories, and then we'll open up for some discussion and questions. And I know that I have, because I came on late, so if some of you end up having to jump off in the middle of this, you just please do that. But I can show you better than I can tell you. So for inclusion, I said I want to reframe the way we honor historical contributions, right? And so I drew a lot of inspiration when I watched this stage show, The Hamilton, which I'm sure a lot of you have seen. When Hamilton draws to an end, the first sentence of the last song, George Washington says, "Let me tell you what I wish I had known when I was young and dreamed of glory. You have no control who lives, who dies, who tells your story." That was like my favorite part of Hamilton. But it got me thinking a lot about who lives, who dies, who tells your story. Mamie Till, for example, people really weren't telling her story. We do know of Emmett Till and those horrific images, but many people don't know her name, and her name is probably one that people should know. So who lives, who dies, who tells your story? So the legacy narrative is a really powerful thing. This is a man, his name is Asa Yancey. Most people who are around Emory and Grady, they have heard of Asa Yancey. We have a clinic named after him, the Yancey Clinic. Asa Yancey was the first Black person to get privileges at Grady Hospital. He was a surgeon. at Emory and built a career at Emory. And he was the first person to join our faculty. And it was a really big deal. He integrated Grady Hospital as a doctor. If you Google Asa Yancey, you get a whole bunch of hits. There's a whole bunch of things that come up. We've done all sorts of things to honor him. This is just a screenshot of me looking up Dr. Yancey. This is our Asa Yancey clinic at Grady. But again, who lives, who dies, who tells your story? Y'all, in 2022, y'all, was the first time I heard of this woman. Listen, y'all, my name is Kimberly Manning. I'm a general internist at Grady. This woman, her name was Dr. Gwendolyn Cooper Manning. She was the first Black woman to get privileges at Grady Hospital. Just months after Yancey, just months after him. Not only that, she was a general internist. She was the first Black woman to get boarded by the American Board of Internal Medicine. Never heard of her. I have never heard of her until 2021 or 2022. Not only that, y'all, she was at Tuskegee Institute before she came to Atlanta. I've never heard of her. Dr. Manning at Grady had never heard of Dr. Manning at Grady by way of Tuskegee. But that's because her narrative was not one that was carried forward. One is a woman, not a man. And for whatever reason, it just wasn't something that people decided to push forward. Her name is not on anything. If you try to Google her, you will hardly find anything. So in reclaiming and rebuilding the narrative, I began to think a lot about the fact that, for example, if you drive through Atlanta, you know that Hamilton E. Holmes was the first student to graduate, Black student to graduate from Emory Medical School. There is a MARTA station named after him, a highway, lots of things. But the woman in this picture, Marsha Lynn Alsops, she was the first Black woman to graduate from Emory Medical School. Most people never heard of her. She's living. She works for the CDC, and she came to Emory's graduation a few years ago. And this is Dr. Stacy Higgins, one of our deans, honoring her at that meeting. And so I began using my platforms to talk about this piece of the narrative. So sometimes it's something just as simple as a tweet with an image. This is an image from one of our teaching sessions, our Beast Mode teaching sessions, where I wanted people to know that, I had just become a full professor. And I said, less than 1% of all the full professors in the U.S. identify as Black women. Again, who lives, who dies, who tells your story? It matters because if I am a pre-med student at Tuskegee sitting in my dorm with a Prince poster in the background, and I don't see any example of anything that looks like me, of course I'm not going to aspire to do certain things. If I am an international medical graduate and I've never seen anybody do anything, be successful to go to the next step, I'm going to start to revise my goals. I'm going to start to think of other things to do for myself. So it's not really an accident that that I didn't know anything about Gwendolyn Cooper Manning. It's just really the way things work. But when I tell a story, now you know. Now you know who that is. This is Dr. Jada Bussey Jones. This is my mentor. And we began to use our stories to help people get promoted. I began making sure that more people knew that less than 1% of full professors in the U.S. are Black women. And we took that and we worked on a project together, started a faculty development program to help get people through the promotion process. And we used these stories of people having doors closed on them or revising their goals to encourage people to go forward. Because oftentimes people get afraid because of, if what the world is saying or what they're not saying shapes your narrative. And so this URIM faculty development program, it led to a whole bunch of people getting promoted. And it really all started with telling the story, right? Telling the stories that people weren't thinking of. This one, there were like 14 participants in the first year. And by then, like 11 people, 9 of the 11 people who were promotable got promoted just from participating in this program. And it all began with a story. So when you amplify and celebrate what's going on, those are stories that can change the way people see what's going on. And that is a form of advocacy. What about health disparities? So in the time of COVID, what was breaking my heart was people not fully understanding the impact of structural racism. So I'll share with you the story of Mr. Washington. Mr. Washington, and it's based on a true story, was a 64-year-old former construction worker, and he had longstanding tobacco use disorder. And he had HFrEF, he had hypertension, diabetes, COPD, and he had frequent falls. Okay. Now, Mr. Washington lived with his adult son. He was underemployed and lived on his son's couch. And, unfortunately, one day while his son was at work, he was walking in the kitchen, tripped, fell, and broke his hip. So now Mr. Washington has been hospitalized and he is brought over to Grady Hospital with this broken hip. And remember, this was during the pandemic. So he was uninsured. One thing we do very well at Grady is we fix some broken hips quick. So we got his hip together, but he needed rehab and he didn't have any insurance. So we're just waiting and trying to find him a rehab center. For our patients who have limited resources, what we know is that sometimes the places that will accept you if you're resource poor are overfull and don't have enough people working there. And so while he was in this rehab center, he contracted COVID. And his COVID wasn't really that severe. He got back to Grady with his COVID, and now we're, trying to take care of him, but he developed a DVT. So yeah, that part we're treating the DVT, and he gets to a point where he's cleared by PT and he could, and they were saying he could go home. The problem was that his son said, "Oh no, you can't come home and stay with me because you stay on my couch. I have small kids. I have to go to work. And if I can't work, I can't feed my kids and I can't afford to get COVID." Right. So he stayed as we looked around for a place for him to go. And while he was there, when people stay in the hospital longer than they should, he got a hospital-acquired infection. That hospital-acquired infection got so bad that ultimately Mr. Washington expired. Now, you might wonder, well, okay, why did this happen? Well, first of all, why was he not in care in the first place? And yeah, he had limited support and he was dependent on others. He should have been able to take care of himself. He was only 64 years old. Why was he putting all that pressure on his son? Why were his resources so low? He should have pulled himself up by the bootstraps and worked harder. And then he had diabetes that was poorly controlled and hypertension and heart failure and COPD. He should have done better, right? And all of those low options, even with low options, Grady was there. Why didn't he do more? And so I think it's important, again, for us to think about. So what I want to do as an advocate is get you to understand the impact of structural racism on somebody like Mr. Washington, right? What I need to do is then think about, what narrative will I tell you? What I could do is I could just preach to you about how hard it is to be Black. I could do that because in some ways that is true. But what if I could show you better than I can tell you? So let's walk you through a story for how we got here. Okay. So let's say if we go all the way back to the history of the Washingtons. In 1880, the Washingtons were people who had been formerly enslaved who were now recently emancipated and working poor, right? By one generation later, by 1905, a lot of those people were sharecroppers and working in fields. But during that time, there was a lot happening with new laws that were making it very difficult for people to survive. By the 1930s, there was sharecropping and people pretty much living like enslaved people without much control. And then again, with the Jim Crow laws of the 1950s, that too became very difficult. So as I mentioned, recently freed enslaved people. Then convict leasing was a big part of the early 1900s, which caused people to be picked up for just standing outside, idling, vagrancy, they would call it. And what would happen is your loved ones would have to come in and try to get you out. But oftentimes people who owned land, they would lease you as a convict to come and work the fields, pretty much as you did as an enslaved person. And again, sharecropping was also not a good deal. And with all of that preceding Mr. Washington, in 1957, he was born. Now, Now we're seeing this a little bit different because there really was no opportunity for Mr. Washington to gain any generational wealth or anything. But still, you could still argue he still should have had more and he still shouldn't have been burdening his son. Well, let's think about what else could have happened. In 1957, Mr. Washington's father was walking home from work. He accidentally was looking down. He bumped into a white woman who fell down. People saw him, and he made eye contact with her and touched her hand, and his father was lynched. That then begins the cycle of Mr. Washington growing up with a single mother who is trying her best to take care of a family in Atlanta, Georgia. Now, like a lot of people, Mrs. Washington, Mr. Washington's mother, was a domestic, working poor, cleaning homes and doing laundry. And she saved up her money because she was on her hustle. And Mrs. Washington hustled and hustled and hustled until she was ready to buy a house in Atlanta. And she had good credit. She paid her bills on time. And she was like, you know what, I'm going to buy me a house, and I'm going to buy me a house in a good area. Well, she tried to get a house in one of these turquoise bluish areas, and they said, no, you can't come there because no. In fact, you're high risk. And so here are the places you could go. And many of you have heard of redlining, which is this process of on maps prohibiting predominantly Black people, mostly from being able to purchase property or obtain loans for homes. And to this day, if you look at the map of Atlanta, the parts that are red then are red now, and the parts that are green are affluent areas now. And so this redlining stopped people like Mrs. Washington from being able to move forward. So she bought a house anyway in a red area with poor performing schools, with limited resources around her, and that is where Mr. Washington grew up. He barely finished high school, and that's kind of where he landed. So in 1987, he had a son of his own. And in 1987, he was caught one day with a vial of crack cocaine that he was selling in his pocket, and he was sent to jail. And during that time, that was the war on drugs. So he went sent to jail for 20 years, which again repeats the cycle of a Washington kid being raised by a single parent. There are more structural racism setbacks, though, more than just those things that happened, right? You might ask, well, wait a minute, why did Mr. Washington and his mother and his family not have more wealth? Well, the Social Security Act of 1935 is actually for everybody except for domestics and agricultural workers. That's how it was set up. So after the period of enslavement, what do you think formerly enslaved people were good at? Domestics and agricultural workers. So people like my father's parents, they did not have access to Social Security, which means the next generation, as they were trying to amass wealth, they were taking care of the generation before. And so that is really a cycle. Add to that the war on drugs and longer prison terms and disenfranchisement, like what Mr. Washington experienced, coming out of jail and not having any, even a driver's license. And those are things that makes it very difficult for you to thrive. So with a felony conviction, being uninsured, and being now experiencing homelessness, it's no question why Mr. Washington had a rough go at it, right? Structural racism and health disparities, I can show you better than I can tell you. And what if now when we're seeing a patient and they're struggling, maybe we can think about go back a generation before that and the generation before that. What are some of the things that maybe happened long before they were born that made it more difficult for them? So I think, Ian, we can talk about it, but I can show you better than I can tell you sometimes in a paper. The legacy narrative and the power of privilege is really important. I think I can underscore even further the point that I just made to you by saying, hey, what if Mr. Washington wasn't Mr. Washington? What if he was the family Washington that owned the Washingtons, right? So what if he had been born white? And what if he was what if his ancestors were people who enslaved people? Well, they would be very rich because people who owned enslaved people, they had money. in the early 1900s, they were the landowners who were doing the convict leasing. In the 1930s, even when the Great Depression hit, back on an upswing came the GI Bill, right? And the GI Bill allowed a lot of people to go to college and get homes. But with redlining, you couldn't get anything. But we often talk about redlining, but we don't talk about greenlining, right? Because if you had the GI Bill and all the access to that privilege, then guess what? You could buy a house in a really great neighborhood. In the neighborhood I live in, which is a block away from Emory, Druid Hills, nearly all the homes around me are owned by people who've been in the homes for multiple generations for their family through generational wealth. We just somehow like tripped into the neighborhood, and I don't know how we got in here, but the very neighborhood I live in, my family, my father as a kid couldn't have walked down the street here. So that's the cycle of privilege. Resources lead to more resources. They lead to achievement and opportunity, access to healthier living, wealth building, and it just goes in a circle. And structural racism keeps people out of that cycle, and privileges keeps people in that cycle. And that's a case for diversity, right? So if I am trying to go to my chair and I'm trying to get my chair to give me some resources for a program, if I tell a story and explain how things got as they are, people might be a little bit more open to thinking about it differently, right? One of the last few I'll share with you in the interest of time, because I know it's getting late, is just about building trust and improving trust through trustworthiness. And again, like Toni Morrison, I'm like, what do I not see people doing? All I see is people ranting. Every time I open up social media, people who look like me are ranting about what people aren't doing for us. And man, I want to get people's attention and get them to think a little bit differently about what we're doing. So I took to Twitter, and I was like, you know what? I am tired of people calling Black people vaccine hesitant. I think of the word hesitant as fearful. And if I'm standing on the side of a pool and you say I'm hesitant to jump in, that means there's a problem with me and that I'm scared of the water or something. But what if I'm deliberating about jumping in the water? That means I have agency. Maybe I want to jump in, maybe I don't. Let me figure out if I want to do it or not, right? So I began to tell stories called What's Your Why? To show people that, look, Black people are not a monolith. Y'all have this idea that that we are all like afraid and think the same thing, and that's just not true. And what happened is people began to engage with these stories. I would tell true stories of what happened to me around the neighborhood. And some of them, it just showed that there were multiple reasons why people were either deliberating still, wanted to be vaccinated, didn't want to be vaccinated, had questions. And it started to really help people look at different ways to communicate with our patient. And then I began to show people, well, let me show you what happens when we tell these stories and we begin to move the needle, right? I began to have people who read my stories send me things like this. He got it. And my response is crying, because y'all know I be crying. And then here was another person who was not a Black American, who was a very, very conservative white woman in North Georgia who began following me on Twitter, asked me for my number to talk to me about the vaccine. And she was arguing with me, and I was just listening to her and like telling her stories. And then ultimately got this, tears, but wore my bravest shirt. She had gotten vaccinated. This was somebody else saying, good evening. After watching your video, I decided to get vaccinated. And my video was literally me just telling a story. And then someone else, a colleague, says, from Grady Doctor, I learned the power of connection and the realities behind much of the Black community's distrust of the medical system, and that Black Lives Matter. So Black Lives Matter became one of What's My Why, and Black Lives Matter became my hashtags that I use to really build advocacy and try to get people to think a little bit differently, to not just be like, have this idea of why people were as they are, but what can I do differently? How can I change it? And even more, I started just telling people, look, I need you to come. And if the person had been someone who was still deliberating, I would just break the logistical barriers. And I would screen grab these things and I would share them with people to show them that, like, don't give up. I think there's a way that we can do this. And one of my favorite ones was this person who, like, this lady used to be like coming for me in the comments all the time. I'm not afraid to get the shot. I'm more afraid of what's in it. Had 3 totally healthy friends pass days after their second dose. And then, after a lot of like really contentious and downright mean things on Twitter, I would just always meet her with kindness. And finally, look, a few months later, I did it. First dose of Pfizer on yesterday. Thanks for all of your encouragement. Me, my response, crying and hearts, right? And this was so much more powerful than me being on CNN or me, being on a panel or me, putting something on my CV that I was on some CDC advisory council or the White House advisory council. I got a lot of people vaccinated just through telling stories. And showing people also that we can keep coming up with ideas. We set up a table in the middle of Grady Hospital called the No Judgment Zone table, where people just came up to us and asked us questions. And I told their stories, asked their permission and told their stories. And it took us a long way. And it led to scholarship, but it also led people to think differently about what it means to be trustworthy. So this is what started as something that was just breaking my heart and me telling some stories. Sure, it led to something I could put on my CV, but it was probably the easiest paper in the world to write because it was all here. And the same goes for all of the things that we choose to do that break our hearts. So in closing, mentorship, and I think you all think about this a lot. And I don't want people to mentor in the way where you say, sign up, I'll be your mentor, sit and have coffee with me at the national meeting. You look at my CV, you say a few things, and you try to put me on your paper, right? But what does it look like when you really show up, when you listen, when you bring more of yourself to spaces? This is a young woman, Asase just graduated from the Osler program at Hopkins. And she's about to go out to UCSF to do GI. But this is when she was a medical student. She was president of SNMA, and I began to mentor her over FaceTime. And all of these little things, right? They start to really, really add up. All of these little touch points, these little loose ties that don't seem like a big deal, they can become a much bigger deal. I highly recommend you listen to this episode of Hidden Brain. It's about the power of loose ties and how, again, Dan was a loose tie. When I came to Hopkins and coached him that day, that was a loose tie. And he is actually still a loose tie. Like, I don't talk to him all the time or anything, but the power of tiny interactions can really go a long way to move you further. This is an image in the time of COVID during the Omicron and like Delta variant period. I can't remember which one we were in, but it was when everybody was trying to get tested and get boosters, and it was impossible to get anywhere. And you guys remember all these long lines of cars. I'm in the parking lot. It's gridlocked, and there was this young man in the parking lot, and he was walking around his parking lot smiling and just waving people around, and he had that parking lot on lock. It was like nothing I had ever seen. He was so organized, so kind, so patient. And I told my son, I was like, that guy, if he worked with me at Grady Hospital, I would be so happy. He is amazing. And my sons just started shaking their heads because they're like, Monty's about to start asking him questions. Oh my God, please don't talk to her. But I was actually hoping and praying he came over to our car, and lucky for me, he did. And when he came over to the car, I was like, who are you? And he's like, what do you mean, who am I? I'm like, who are you? What do you, he's like, I'm a college student. I said, a college student where? He was a college student at Clayton State, which is a commuter state school here, not a one that's really known for getting people in medical school. I said, everything I see about what you're doing in this parking lot is mind blowing to me. What are you studying? He's like, I'm a health sciences major. I don't know what I'm gonna do. Maybe be a medical assistant, or I was like, have you thought about medical school? He's like, well, I don't really think I'm a person who could go to medical school. I don't really. And what it really was is that he didn't have any social capital. He didn't know any doctors. I said, what I see you doing in this parking lot, I can tell you right now, you would make a better doctor than a lot of doctors I know. You are amazing. I'm going to give you my phone number. I tell you what, I'm going to give you my cell phone number. And if you think you might want to know more about going to medical school, reach out to me and I'll talk to you. He texted me the very next morning, allowed me to share his name. Hi, this is Krishan from Viral Solutions. Look forward to hearing from you. And that was the start of our mentor-mentee relationship. began mentoring him over Zoom and over FaceTime, got to know him really well. And it became very clear that he didn't know any doctors. The things he would say to me, it was clear that he had not been talking to anybody who was in medical school or around medical school. And how will you? Like, he was born to a 15-year-old mom who had passed away, was being raised by his grandmother, helping raise younger siblings. And y'all, this is something I get honest. This is how my dad was. My dad, we used to say he picked up strays everywhere, but it was really loose ties. And those loose ties can really go a long way. I got to know Krishan because really good mentoring is putting in time over time. And he was trying to study for the MCAT, and he was so downtrodden. These are text exchanges. I'm trying so hard. I mean, this is your season. I just finished a practice exam and I feel so defeated and worthless. What did you get? You're never worthless. I don't even want to say it. Worse than any practice test, no matter what your score is, you got. Child, just tell me. I don't want you to be disappointed. I can never be disappointed. Then he says he revised his goal. Remember, I talked about revising your goal. Do you recommend waiting the next cycle so that I'm not a reapplicant? No. I'm ready for you to get into medical school. What's your GPA? So that's how it started, with a loose tie in a parking lot. He started to apply to medical school. Now I know him, and I know everybody. So I wrote letters. I edited his personal statement, helped him do all the things that people do when they have social capital and connection to people who can help them, right? Because now he knows me, right? And we got his application together, and he was really, really appreciative. And then he got accepted to medical school that very next year. Got into Meharry, Morehouse, and like 4 other medical schools that he applied to. And he did all the work. I am absolutely confident that he had everything that it took to get into medical school. But I'm also sure that radical mentorship, right, that a loose tie that became a strong tie made a huge difference here. And if you are somebody like me who works in the space, the DEI space, and works as a mentor and works in medical education, we get burnt out and we get tired. But nothing gives you a shot in the arm like something like this, like getting a text message from a kid you randomly met in a parking lot in the middle of winter, telling you that they got into medical school. That's really what mission is about. And what was breaking my heart is that when people do not have the social capital because of all of the ravages of structural racism that have left people in certain spaces. I won't even get into the fact that he lived in Clayton County, which is where all of the folks who lived in projects in the city of Atlanta were moved to and displaced to during the Olympics. It's very complex. That was breaking my heart. I didn't even know that about him when I watched him. But I did know that he would make a good doctor. And it's so much bigger than that, right? He was the first in his family to graduate from college. This is him on his graduation day with his grandmother. Grandmother didn't even graduate from high school. And this is him. Now, I can't put this on my CV anywhere. I can't. But what I can do is tell you this story. And you do not have to be a full professor. You do not have to be me to be able to do something like this. Because all the things that I did for Krishan, an intern could do. A second year, third year resident could do. It's just time over time. So loose ties can change lives. And again, a little can go a long way. So turns out Gwendolyn Cooper Manning, her name was actually Mannings. It would have been really cool if it was Manning, but it was Mannings. Too bad. But I began to learn all about her, learned a whole bunch more about her. She went to Spelman College. Turns out she went to Meharry Medical College. We went to the same medical school even. Never heard of her, right? Showing us here here's the appointment of Gwendolyn Cooper Manning at Grady Memorial, a graduate of Meharry, my school. Never heard of her until 20-something years after I joined the faculty. And then raised her family in Tuskegee, which is where my mom is from. Didn't know any of it. But now you do know. Now you know. And here's my son when he was in middle school, and I was standing outside telling him all about the desegregation of Grady. And I told him the story of Asa Yancey, because back then I didn't know anything about Gwendolyn Cooper Mannings. But if I told him the same story today, it would include her too. So Asa Yancey was really, really important, but she was too. Who lives, who dies, who tells your story. And all of these things are connected. It's a form of advocacy, right? And if I want you to understand why less than 1% of full professors in U.S. medical schools identify as Black women, Maybe it's because people's stories get erased. Who lives, who dies, who tells your story? So my take-home messages are narratives can ignite change and play an important part in the role of mission-driven work. And stories give meaning to why we do what we do, because it's not enough just to do stuff. I promise you, you will become the cardiologist that you want to be. You will become the interventionalist, the structural person, the congenital person, the preventative person. You will become those things. You will write a paper. You will get a grant. I'm telling you, that is going to happen. But at some point, all you can be is happy. And the closest way you can get to happy is through finding mission. And stories really help to underscore that mission. Intentional use of narrative can build consensus. A lot of people that don't agree with you, the true north is that we care about human beings, and stories often help people see that. And narratives can create urgency. So that, my friends, is it. And it's all of our job to let the world see. And sometimes the story is just the image, because you can just look at these 3 images here, and I don't really have to tell you a lot more about what I care about or what I'm like or how I roll, because sometimes I can show you better than I can tell you.